Hi everyone, I'm Bronwyn Fitz. I'm an integrative gynecologist and functional medicine doctor, and today I want to talk about osteoporosis. This is the thinning of the bones that many women experience as we get older, as we go through menopause. It's a big source of chronic pain, disability, causes the need for joint replacements and surgery, all kinds of things. And women come to me and they want to know, what can I do to prevent the bone loss, and then what can we do to reverse it? So first I want to talk about what some of the risk factors are. I mean, I mentioned being a woman and being older, being white or Asian, having those ancestries, being a smoker, chronic alcohol use, and then there's certain medical conditions that predispose you to osteoporosis, things like diabetes, inflammatory bowel disease, rheumatoid arthritis, and then there are some other, things, medicines and things that can predispose you. But I think the fascinating thing that not a lot of people talk about is the common thread we see in some of those risk factors I just mentioned is inflammation. Inflammation puts you at increased risk for osteoporosis. And in a way, this is kind of good news because we can do lots of things to improve our inflammatory status, if you will. In functional medicine, we like to call ourselves inflammologists, and we're constantly looking for what's the source of inflammation, and we root it out and try to, figure out the puzzle and address it and remove that source of inflammation, whether it's, stealth infection, food sensitivity, environmental toxin, you name it. But so inflammation, we're going to back up a second and talk about bones. The bone is a very dynamic tissue, and it's constantly getting remodeled or kind of turning over. Little imperfections are identified and then broken down further and then rebuilt. And that process that remodeling process has influences from both inflammatory molecules. Lots of different inflammatory cytokines, we call them, can drive inflammation. And it's also protected by estrogen. So estrogen has lots of different effects on the bone. One of the ways it helps bone density is it actually blocks some of those inflammatory mediators. Now, the fascinating thing is that if you think about it, as a woman goes through menopause, her estrogen levels will decline. That's kind of the nature of menopause. And in that first year or two afterwards, there's usually a pretty, noticeable dip in her bone density. As that estrogen goes away, we're losing that protective anti-inflammatory effect. And whatever inflammatory mediators were kind of lingering or hanging around, all of a sudden are unchecked, and they're causing an increase in that bone loss. So it's logical to think that all women will have some bone loss at menopause, but the women who have higher baseline levels of inflammation are even more at risk for bone loss. So I just think that's important to recognize, and in a way, it's good news. Like I said, we can take steps to decrease this inflammation, and we do this in functional medicine all the time. So in my approach to women's health, and someone who would come in with concern, whether it's PMS or polycystic ovary disease or osteoporosis, we look for drivers of inflammation. We do a deep dive. We look at your nutritional status. We look for bacterial or yeast overgrowth in your gut. We look for environmental toxins. We try to root out all these things and really strive to have as much of an anti-inflammatory kind of lifestyle as possible, but with specificity to really address what's going on at the individual level of each woman. So I think it's fantastic that we have these integrative approaches where you don't just have to put everybody on medicine the second they have some lower bone density on a DEXA scan. Medicines, of course, have a role and can be very helpful in mitigating the bone loss. But if you're interested in learning more about my practice, give us a call, 203-900-4194. Check out my website, women'sintegrativehealth.com. And I give a free 15-minute consult for our all prospective patients, so you can get to know me and I can get to know you, and make sure it's a good fit to work together. And so give us a call and have a wonderful day.